everyone. Thank you for spending your lunchtime with us today. I hope folks have their tuna salad in front of them and are ready for some scintillating discussion. I'm Catherine O'Neill Dunham, and I'm very proud to be a board member of Children's Village. And along with my co-chairs, Katrina Dudley and Joanna Horowitz, I want to welcome you to today's program. In the before times, this luncheon was a moment for us to reflect on universal themes around adolescence and family challenges, and to understand the ways that youth and families that are part of Children's Village are intimately connected to our own families and communities. And with the COVID-19 crisis, I believe that we're seeing on a massive and indisputable scale the ways that 400 years of racist practices, policies, and policing of bodies of color have intertwined to protect families like mine and exacerbate the devastating conditions we have created for families of color in the US. I live in a really old house, and when we replaced the windows, we found newspaper from the 1800s in the cracks. And that was the insulation for the house in those crevices. Today, during this webinar, we're going to look at the cracks and the crevices that we don't often see as a country and explore the ways that COVID-19 has exposed inequities in our healthcare and our housing, in our education, employment, wealth building, and yes, our child welfare system, which sits at the intersection of all of these areas. And I could not be more pleased to have my former Inwood House board colleague and the president and CEO of the Global Fund for Women, Latanya Mapp-Frett, leading us in this conversation today. In her role, Latanya is working to strengthen gender justice movements, to shift power, privilege, and perception, and create really meaningful change that will last beyond our lifetimes. The Global Fund for Women supports more than 5,000 groups across 175 countries so far. And Latanya is no stranger to exposing cracks in systems. She previously served as the executive director of Planned Parenthood Global and worked as a human rights officer for the United Nations Children's Fund and spent 10 years at the United States Agency for International Development. So we have a fabulous moderator in Latanya today, and I want to welcome her to our meeting.
Thank you so much, Catherine. It's such a pleasure to be here. And I'm really excited about this conversation. In fact, I'm on the East Coast now. You know, I live in San Francisco, so I was on the red eye tonight. And I kept thinking, before I go to sleep, I get to have this incredible conversation. And so what I want to do is first introduce the esteemed panelists we have here with us today. And then we'll just get right into the conversation. And I think we'll do that for about 30 minutes before we open it up to questions and answer. And we have lots of help here to try to feel through. So I guess if you have any questions, throw it in the question answer or in the chat box, and we'll keep up with them so that when we get to that portion of the conversation, we'll be able to gather some of those questions. Again, it's just a pleasure from my days at Inwood House to be able to have this conversation. I left when the merger happened with Inwood House and Children's Village, and so it's good for me to be able to catch up to what's happening at this point. And so to help us do that, Dr. Tracy Gardner, who's the medical director at the Children's Village, will be here with us. As most of you know, she made history as the first woman and African-American medical director of the Children's Village. She's also the chief medical officer for their division of immigration services. She's the first woman and African-American as the director of community engagement or she was at New York Medical College. She's a fellow of the Center for Juvenile Justice Reform at Georgetown University's McCourt School of Public Policy, where they work with LGBTQ system-involved youth. And she sits on the board of directors of the Westchester Institute for Human Development and the advisory council for the attorneys for children at the New York State court system. So as you can see, she's got a lot that she's going to be able to share with us. And then, of course, we have Dr. Jeremy Kahumban. He's the president and CEO of the Children's Village. And the president, of the Harlem Dowling. Under his leadership, the Children's Village the nation's oldest and once the largest children's residential treatment center, has been transformed into a national model for community embedded family support. So Jeremy's contributions are noted all over the place. I know so many of us see him in the New York Times, quoted in the Post, Fox Business, and NPR. And so looking forward to hearing from him as well. But first, we're going to start with Quaniqua Randall. And Quaniqua is a foster parent at the Children's Village. She's been involved with the Children's Village since 2015, where she became a foster parent to 3 siblings, 2 girls and a boy. In her time with Children's Village, she's navigated the many ups and downs that come with fostering and developing strategies that work for her and her kids. Quaniqua has said that every day is different, some harder than others, but the smiles on the children's faces make it all worth it. And I know today Quaniqua has a house full of children, so she'll be able to give us a lot. Quaniqua, we want to start with you because we really do want to understand the realities that COVID have had for you, and to help us sort of start this conversation when we think about the cracks that we're seeing in the structure and the system. So why don't you give us a little bit of detail about what you're experiencing since COVID has happened?
Well, as far as COVID just wrecked everybody's life, I think. I think it was a lot harder on the kids. For me in particular, my kids came with severe health issues. My youngest one, she was diagnosed with fetal alcohol syndrome. So a lot of things were not developed on her. One pertaining was her lungs. So before COVID even hit, my daughter always had, medication. She always had a regimen. She also had a standing order of prednisone because every year she got very sick. So as far as that, I was very nervous. I didn't know nothing that was going on with COVID. I just knew trucks was in front of hospitals, getting bodies out. I didn't know anything. My kids stayed inside. I was nervous. They didn't understand. They didn't understand why we can't go outside to the park. Why can't we do this? In the midst of it, my kid's mom passed away 4 days before my son's 10th birthday. So that also made it hard because I didn't let my kids go to their mom's funeral. It was hard for them to understand why. But I had to make that decision because there was just so much going on. School, I felt, like I said, I own my own daycare. So I'm, I have education behind me, but when you're dealing with children that have IEPs, which 2 of my kids had IEPs, it kind of bothered me because I didn't want to fail my kids. I didn't want to fail my kids because, listen, I know 4 + 4 is 8. But when you look at this new map, you look at all of this, you be like, wait, I need Google, so I didn't understand a lot. And then my kids didn't understand why I can't go to school. Why I can't see my friends. So what me and a lot of the parents, we used to do our own Zoom with the kids. Like on the weekends, we would just Zoom and the kids would be in the living room and we would just put our phones down and just let them play with each other, talk to them. They could talk to their friends. It wasn't the same, but we tried. It just was bad. It was really bad. It was depressing. It was really depressing. I felt, I would see my kids. I purchased so much things for the kids to try to keep them engaged and stuff. It's only a little bit of things that you could do in the house, but we tried. We did everything we can to try to keep the kids' spirit up. Mommy, we can't go outside. Why can't we go outside? Because of this. So we would, buy a lot of stuff. You're in the backyard, you're doing it. It was just so hard. The agency definitely helped a lot, making sure we were good and, do we need this? Do we need that? Which, I'm a foster parent that normally I'm good. My kids do their visits and all of that, their medical, we're good. But it was very hard. It was very hard. My kids have went back to school. They're socially, when this was going on, I saw the difference. I saw, with my youngest, Tion, that's the one that have a lot of the majority of the medical issues. I saw the regression in her. And I kind of got nervous. I spoke to Doc about it. I kind of got nervous because what I had taught her, we had to start all over with Tion. So what I taught her, I kind of started seeing her not do. Mommy, can you help me tie my shoe? Huh? You know how to do that? Mommy, can you help me do this? Tion, like what's going on? So I started seeing that, and I had even asked the doctor at one point, like, what do you think about school? You know, because like I said, I didn't want to be the one to not take her, you know, to not let her go. And then, you know, sorry. And then, you know, it'll be on me. But you know, as of right now, things are getting better. My kids are back in school. That's it.
Monique,
That's
remind
it.
me how old they are, just so we have a feel for the children. How old are the three that you have with you now?
10, 10, 9, 7.
Okay.
And when they came into care, they were 14 months, 14 months, 14, 3, 4.
Excellent. Yeah.
Something
No,
like that.
no,
But
that's
they've
helpful.
been with me for a long time.
Yeah. And just the you know, the incredible amount of challenges and all, you know, the care, you know, under COVID is really, really different. And so I, you know, I just wanted folks to have an understanding that, you know, the children that you're talking about, I have 2 older children, and I know how difficult it's been for me just to get, you know, high school and college students through. So I can imagine what you're going through. And you lay out so much about the inequities too in our society when we start thinking about COVID and access to services and the ability to be able to, in some ways, you have to double down, right? Under COVID, you've had to really, really stretch yourself. And I'm sorry to hear about the kid's mother during this time, because there's no good time, but I know during COVID, it's especially a bad time. I want to move over to Dr. Gardner and talk to her a little bit about what she's hearing from Nico. You know, I think there's so much that is happening right now that's, you know, some of it we see and a lot of it we don't see. But, you know, this access to healthcare, and we'll come back to education because that's a big part of what you're talking about. But it seems that the access to healthcare and the environmental conditions prior to COVID played a huge impact on patient outcomes during this crisis. Can you talk a little bit more about that, Dr. Gardner? And what's the long term that you're seeing impact on people's health and well-being right now?
Yeah, thank you so much for having me, and I cannot thank Ms. Randall enough for being here and being a voice for our foster families. It's challenging because when you talk about health and well-being of a child, you're talking about the whole child, right? So all of that, the development of the child, and that involves the education, their actual physical well-being, their mental well-being, and what have you. And so these are the most pivotal times in their lives during their development. And so when she speaks about regression, those are the things we can see. But there's some things that we won't be able to see. The trauma that goes along with what has not just losing a parent, but losing a parent in a time of a pandemic, when you can't also have all of the normalcy that would sort of act as a safety net for you, your friends, your family, your school. And so those things are also missing. So we are going to have to be super vocal with our young people about what they have experienced in order to not have it have a long-term health and health impact on them. Because all of this it's a physiological response. It's not just an emotional one. And so in order for them to sort of get past this or to help them to work through it, we're going to have to really be able to have these conversations with them at all developmental ages.
No, and that's you know, and it's so important that you're saying that, and you know, and during this time, and I can't imagine what it must be like in New York City, but for Global Fund for Women, we've seen across the spectrum in the countries where we support women's groups that there has had to be additional services put in place because let's say your normal places where you're able to get support, the clinics, the community clinics, you know, some of the even hospitals weren't available unless it was an emergency, right? And so they would say, well, you know, for a normal checkup, you know, and I think Kanika is saying this about some of her kids have already had challenges of which she has to take them to the hospital. But during COVID, those were closed down to some of the children. Is that the same as what you found in New York, that some kids couldn't go for their regular appointments because the system was overstretched with COVID?
Yeah, so that in March and April especially, right? I mean, it's sort of, we had a massive shutdown, right, of our state. And so we were always available and accessible to them. We did not close our clinics.
Okay.
You know, we understood the importance of that. They did not, you know, their lives didn't change. They still had foster care youth. We still had youth in residential. So that didn't change because the state shut down, but we had to figure out a new and different way of of working with those young people and working with families, not at the same way that we did before, because we couldn't be in there 9 to 5. On residential, more easy to do, but in community, much more difficult. And the truth is, the parents were afraid. Like, I mean, so many parents said to me, I don't want to leave my house. Like, I don't want to come to the clinic. Like, I don't want that. Like, I'm fearful of having contact with anyone else outside of my family cluster. Those were real challenges for people. So we, you know, having to now really have telehealth, really have extra long conversations with people. It wasn't just about the health, but it was also about reassurance. And in addition to that, we also had people who were caring for the young people who were going through their own issues, right? That we had foster parents whose family members were having COVID, whose family members were also passing of COVID, who were also experiencing their own issues, their own health challenges, in addition to the families. So, in addition to the children. So you were really having to be a resource in a much more holistic way, I think, than we've ever had to do before because of the complexity of the issues.
Thank you, Dr. Gardner. That's so important. I'm gonna move over to housing, Jeremy, because as we've seen, some of these inequities and disparities really depended on where you live. I mean, that in itself is not new. I mean, we have seen this, you know, before. I mean, the issues around affordable housing structures, and you know, the potential breeding ground for infection was initially feared. But we saw those that could afford to leave the city did. And also, I mean, we know this is not just a New York issue. This is all around our country and all around the world. These disparities around housing, whether people actually have housing, those that don't, is there affordable housing and what all that looks like. Can you talk to us a little bit about what you saw during COVID?
Yeah, I think you know, when we talk about housing, we are really talking about segregation and the hallmark of segregation, which is the so-called affordable housing that is typically high density, poor quality, poor design, housing that lacks common space, that lacks access to the open space. And in most cases in the greater New York City area, it is also housing that is typically situated at a greater distance from resources like transportation, supermarkets, medical facilities. And these developments became a real channel for the spread of COVID. And, you know, we were on the street, as Dr. Gardner mentioned, you know, we just didn't close, we couldn't close. And as we went into these neighborhoods, what you saw was by the second week of March 2019, those who could afford to leave the city had begun to leave. And those who could not, but had the resources, had also begun to plan. Now, as both these groups made their plans, the one group that began to leave, the other one that said, okay, I need to hunker down, they went into the supermarkets and they emptied out the essentials, right? Anything that was non-perishable, toilet paper, anything remotely connected to sanitizer, including gallons of bleach, various types of cleaning liquid. And in the supermarket opposite our building in Harlem, even the nail polish remover was gone when I walked in there during the second week of March 2019. By the time our poorer families found the money and the time, right? Remember, so many of our families are also essential employees. They didn't get the time off. They didn't always have the spare change and the money. By the time they got to the supermarkets, and that's around March 11th, March 12th, everything they needed was gone, and what was left was triple the price. We had a staff member in the Harlem building who said that she walked for hours to find a gallon of bleach, and a gallon of bleach that a week prior cost about $4 was now $9, right? And that was the reality. And as the city locked down and those with resources settled inside their homes, what we saw in our segregated neighborhoods were families traveling greater distance, often walking in and through the zones most impacted by COVID, just to find the bare essentials that they needed to survive. So this journey of searching for resources, of stepping out, right? And in fact, I had colleagues that said, why is it that when you go to Harlem, everyone is out on the street? Well, they're not out on the street because they want to get the virus. They're out on the street because they're trying to survive. And that condition continued through March of 2019, well into the end of May of 2019. Nothing changed. Many of us benefited from the online marketplace. Many of our families did not. Either they did not have the credit, they did not have the credit cards, they did not have Amazon Prime, or the buildings are not designed to accept boxes, right? So we have these old buildings with mailboxes, but no place to keep a box or to keep it safe while you're at work. So you can see what happened in these neighborhoods. It was the design and the segregation and the density played a role, but it is also where we situated these buildings and what happened to them, to the people that live in them.
I mean, it's, and in some ways it just makes so much sense that we should think about these things, but during, anyway, and all the time, but it just seemed during this pandemic, last year, this time, we were just completely unprepared. And then let's just talk about what Quanika brought up about school. You heard what she was saying about how she was trying to figure out, past basic arithmetic, how she's going to help the kids and see them thrive. I know, in some countries around the world, kids have lost a whole year because the idea of remote learning is not possible for so many other places. In New York City, I know in some form or another, most of the schools went into some sort of remote learning. And how did that impact what was happening over at Children's Village with the young people there? How did you guys manage this?
In our residential programs, we actually kept our school open. Because we didn't think our young people could survive a lost year. And
wow.
And it worked well for us. It really did. We had times throughout 2019 when we had to close, but we went many months, especially early during the pandemic, doing it well. However, I think it's worth mentioning something that we all know, but let's make it explicit. Poor children in the United States and in New York get a poor education. That was happening prior to the pandemic, right? That's nothing new. For most of our poor children in New York, education is a second-class experience. No question about that. When COVID hit, those disparities were magnified because most of our poorer children had no technology. Their homes did not have access to broadband. Their homes are crowded, so they don't, even if they had a hotspot, they didn't always have a quiet space to work in. It took the Department of Education 6 months to get their children, many of these kids, an iPad. And if you noticed, in November of last year, where on the 18th of November, when the Department of Education said we're going to close the schools down again, the chancellor said that 8 months after the pandemic began, of the 300,000 children that had signed up to go to school, 160,000 would be going home to remote education without the technology they needed. 8 months after the pandemic started. And we were surprised by it because in our case, we got technology to all our young people. We got them laptops, Amazon Fire tablets, and hotspots. And we fully expected the Department of Education to do the same. But on November 18th, the message was, yep, sorry, we're going to close the schools again tomorrow, but about 160,000 of you will go home to do remote education without the technology that you need. Bottom line, our kids, many of our young people in the community have lost a year of education, and it's going to be a real struggle to get back.
Yeah. Yeah, we'll be reading about this for a long time, that the fallout for sure. I don't know, Dr. Gardner, now, with the vaccine available, I've heard so much about, Black communities, brown communities, how this is impacting their recovery. And we're also hearing, that there's less uptake in our communities for many different reasons. But I mean, how are you seeing the vaccine? How does that relate to recovery? How are you thinking this is going to go for many of our communities?
Yeah, so, unfortunately, there are a lot of issues in regards to vaccine distribution and dissemination within certain communities. We've been fortunate recently to be able to get vaccine for for residential and child welfare, and also community based based on the services and the system that people are in. But that's, so now that we have access. In the beginning, there wasn't, right? There was just a supply and demand issue. There just was, right? But you did have to overcome the reluctancy. And that, what we are seeing, so there was a reluctancy within the Black community, but then there was a reluctancy within generations, right? So then it became that you could get sort of and there's socioeconomic, right? So it's multifaceted. We are, Black and brown people are not monolithic, that they are a group of people that are diverse. And so you saw that those who are older were maybe skeptical because of what they knew about what had happened in the past with Tuskegee and all of the other types of medical apartheid that had happened in the past. But they were more willing then once they saw other people taking it, and there were credible messengers within the society, much easier, right? When you talk about young people, their exposure to that information is very different. It's very social media driven. It's very peer driven. And so, young people in programs like ours and Inwood House, where now the same, access to counseling and healthcare and all of that had been thwarted because of the pandemic, the communication is different. So it is, once again, very social. It was always social media heavy, but then you didn't necessarily have all of those other safety nets to sort of contradict that. And so unfortunately, we are seeing that young people are still way more reluctant to take the vaccine for a variety of reasons. I mean, and you hear everything, from nanobots, and whether you believe that to be true or not, they believe that to be true. So you can't invalidate someone's belief system. You sort of got to meet them where they are and then educate them on how to get to the place of safety. And that is a challenge when you also have some of their people that they look up to also saying the same sort of thing. So I was very happy to hear, though they didn't publicize it as well as they should, that the NBA did in fact give the vaccine this past week, and they need to put that out there because a lot of the basketball players were in fact against the vaccine and were pretty vocal about it on social media. So our task is to find ways to sort of get to these groups, the young people who we serve, and that's across our agency, Inwood House, the residential community, the whole agency, to continue to work to help them understand that the only way we're truly going to get out of this thing is with the vaccine.
No, it's so important. And Quaniqua, I don't know if you have any thoughts on the vaccine. How are you thinking? Are you going to take it? How, people, your mom and other people? I mean, how are you? What's going on with you when you hear Dr. Gardner talk about the vaccine?
She's laughing because we had a conversation on that,
okay.
and for me, I'm gonna say a no for right now. I know I just keep, and I'm gonna be so real with you. I was just laughing with some of my friends over this weekend, and 3 of them was at our home, and they had the vaccine. So they was like, "Oh, Q, when?" No, I'm not. And I said, I keep feeling like in 5 years we're gonna be sitting watching TV, and they're gonna be like, "Did you have the Johnson & Johnson vaccine in 2021? Is your head hurting?" Like I just keep feeling like it's gonna be something to deal with it, and then I just think of like, scientifically, it takes so many years to develop certain things. Now we got this so quick. And I'm just a little skeptic. I just feel like there's been cancer, there's been AIDS, there's been so many things that still we don't have a cure for. And now here comes COVID. I got something for you in 7 months. That's scary. That's scary because it's like, do you have it for everything else? Because we don't lost a lot of people. So I'm just mixed feelings. I spoke to Doc a couple of months ago. I have been doing my research, Doc, because she let me know, there was African American scientists that, put their input with it. So I've been doing my research, but as of now, I'm still like, I'm just an old school cod liver oil person and all of these little different things that I used to take as a kid. And I'm 41 years old, so it's good on me now. My kids, I give them the same regimen. I give my kids the vitamins. I do the same thing to them. And that's it. For right now, it's still a no.
Now we hear you, and I love the way Dr. Gardner talked about it with meeting you where you are. There's a lot of information out there, and so we'll wait for you. I know at Global Fund for Women, we've been talking to a lot of women around the world, and it's been interesting because, as some of you know, the Johnson & Johnson was used for Ebola some years ago, and so that's kind of how they started with their process to get to where we are with the COVID vaccine that they're putting out.
If I can just say one thing,
ahead,
and also with Johnson & Johnson, I just feel like y'all can't give me nothing. I just feel like y'all are settling lawsuits.
I don't mean to laugh. I'm sorry.
I know, but I gotta be real, and Doc know how I am. I just feel like Johnson & Johnson, you can't even give me nothing right now. I don't even want your skin oil. I don't want nothing. You're settling lawsuits for cancer with baby powder. We're good, so it's just like so much. It's like, I don't know. So
I appreciate you being honest
research
about that. I think it's helpful for us to know where people sit, and and you are not unique. There's so many folks that are thinking about this, and because of our history in the United States, quite frankly, these are valid concerns for us. Jeremy, can I turn to you because we're sort of we're at this precipice, so we're to come out of this, but as you saw in Europe just now, so the vaccine started and people got free, and then, and now they're all back in lockdown, again. So, we still have a ways to go, but then there's going to be the issue around employment and income and the fallout on the economic side. Not that people aren't feeling it now, quite frankly, because they are, but would love to just hear from you what you're seeing on this side, on the employment, income, and the potential, I think is pretty much guaranteed fallout we're going to see economically from this COVID period.
In the 13 densely segregated communities where we serve, we see 2 indicators to an ongoing problem that might take us much longer than we probably wanted to take. So the first is, for the last 4 decades, the food service industry has depended on a low-wage workforce, many of them undocumented, for the back of the house functions, right? The washing of the dishes, bussing of the tables, and probably cleaning up after hours. However, in the past 5 or 6 years, this same workforce has also benefited from the gig economy and the app culture. And we hear it in our community centers. People that work in the restaurants at night are working for TaskRabbit during the day. So you buy a piece of IKEA furniture and you look at 3,000 pieces of nuts and bolts and sticks, and you say, hold it, I'm not touching this, let me get someone in. And those tasks actually paid better because they also came with a tip. If you work in the back of a restaurant, you're not getting a lot of tips. There are some restaurants that share widely, most don't, right? But when you went into a home and you did a good job with assembling a bicycle or a piece of IKEA furniture, you typically also got a tip. When the pandemic hit, we lost all our restaurants, and many of them will probably not come back because many of our officers are not going to be at 100% employment for a while, our buildings. But people also did not want other people in their homes, right? Who amongst us wanted someone in their homes? And the question of, what happens next? These people lost, they lost their restaurant jobs on the 12th of March, and then very quickly realized that there was no gig economy that they could tie into. And many of them are undocumented. Early in the pandemic, certainly March, April, May, many of the families that came to us who are undocumented could not go for food. Remember, this was also during the Trump administration. They were afraid that if they signed up at a typical food pantry, that somehow they would get reported to immigration. I think they sacrificed a lot and probably, again, traveled great distances to find resources. And that also added to some of the contagion that you saw in those census tracts.
And Jeremy, let me just ask before, and we'll go to questions soon. So guys, if you have questions, please put them in the question and answer, and we'll be able to open them up and take them. But Jeremy, how are you, I guess, thinking about the stimulus? We've had now, I think we passed the third stimulus. Has this been effective for the communities that you're talking about? Do you feel like we have gotten it right on the federal and state level? Are we getting people what they need? Would love to just, from your vantage point, how are you seeing that?
I think at this point,
Mm-hmm.
we are getting people what they need.
Okay.
Most organizations and Children's Village isn't unique in this anymore. We were unique in the early part of the pandemic because we didn't close and we kept everything open, but others have joined us. We are meeting people's needs. But if you go by our food pantry at 126th Street, you'll see the line still goes around the block, right? The line still goes around the block. So we are doing better, but poor people are not poor because they love being poor. They're poor because many of them have been forced into generations of poverty and put in these places where, they are stuck. And no stimulus is going to unstuck that problem. We have to just double down and do better.
I absolutely agree. And I thank you for those remarks. And I have seen, from looking outside of our country too, it's been really, really challenging to deal with COVID. We've seen people who, can't even translate really what a stay in place means. There's 4 generations in a household, and how do you social distance in that kind of environment? And so many people who have both in the communities that you're talking about, but also around the world, who exist in an informal economy. And so, when things shut down, they don't just go home and get on a Zoom and keep getting paid, right? I mean, this is going to prevent them from getting food for the day. And I know there's so much that can be done, and our guests will want to hear about that. But I wonder if I should turn it over to Joe for any questions that are coming out of our colleagues who are participating. Joanna, I'm sorry, Joe.
Hi, everyone. Can you hear me?
Oh, okay, Rose, I'm
Hi,
sorry.
this is
Yes.
Roseanne.
Yes.
So we do have a question in the chat. And it is for each of our panelists. Going forward, what is the one thing the government can do to help families who have been hurt by this pandemic?
So do we want to start with you, Dr. Gardner?
Sure. I think to acknowledge that families have been hurt by this pandemic is probably step one. I think we're there now. I think there was a lot of coded language in the previous administration that was really centered around economics, and which sort of is described, which Jeremy described so well about, bleach going from $4 to $9. I mean, many people who have the power to really make a difference for the whole population decided to benefit by what was going on, which is why you saw such a disparity in economics. So I think to acknowledge that this, that when you talk about the population, that it also included, people who were, middle class, right? So the middle class became part of the poor class, because that's why we saw so many people in food lines. I mean, I was so shocked and dismayed by the sheer volume of food lines throughout all of the communities that we serve, and that we saw and that we witnessed on television in other states. So I think part of action is acknowledgement that action needs to happen, right? So you have to first acknowledge there is a problem, and then the government is got to acknowledge that action is required. And I think we are on the road there, but since action is so dependent on who holds the office, right? It has to really have meaningful legislation that can be long-term. It cannot just be, executive orders or what have you. It really has to be thought out on how do you make long-term sustainability.
Thank you, Dr. Gardner. And Jeremy, before we go to Quaniqua, I mean, I love that question about what's the one thing the government could do, and specific for Inwood House. I'm sorry, specific for Children's Village. I'm gonna interchange them. But what do you want to see? What do you want to see happen?
We think the long-term solution for us as a nation is to move to integration. Whenever we put a group of people in one place, it is easy to treat them unjustly as an entire group, right? We have to build integrated neighborhoods. We cannot go another 125 years with the kind of segregation that we've created. The numbers will not allow us to find peace with this strategy. Personally, I know from being in integrated neighborhoods that my own children do better when they're with people that look unlike them, that think differently. That is the promise, right, of the United States. I always think of this idea of out of many that we become one. Well, that hasn't happened, but maybe this is the chance that we make it happen. And I think government has a powerful role to play in this. We cannot build more affordable housing that's ugly and broken. We have to build beautiful, affordable. We also need to stop building affordable buildings in segregated neighborhoods. Those neighborhoods are densely packed. We have to fight the moral battle and the legal battle to bring affordability into our neighborhoods that have rejected affordability for the last 100 years. And the people, this is generational. The people there right now will not like it. It'll be a huge change. We just spent 2 years in court on our Inwood project in Inwood, Manhattan, to win that battle. But their children, I think, will have a better life. And the children of those families that move into integration will do so much better because their schools aren't failing.
Very powerful. Thank you so much, Jeremy. Quaniqua, what about you? Let's just use a short time frame. Not that what Dr. Gardner and Jeremy are saying is too long. We hope we hope we'll see this in our lifetimes, but certainly getting at some of these systemic issues. But when you think about a year from now, what is it that you hope to see? What could the government do to make things better for you and your situation in a year?
I'm still learning. I think what Jeremy and Dr. Gardner said, to basically just, wrap it up, that. I think what I think it's taught me, and I hope it's taught everybody, we are all the same. When it was time to go look for toilet tissue, to stand online, we all different colors, different nationalities, we all was out there together. Trying to get Clorox wipes. Like I said, I own a business. So in the beginning, it kind of affected me where it didn't affect me, where I just went into like Restaurant Depot and just bought up. But then it got to the point where it's like, wait a minute, I can't find this, I can't find that. So I think as a people, we all was out there together trying to make it, trying to get things for our kids. And I think it kind of humbled the world a little bit, because it don't matter how much money you had at the time COVID hit. It don't matter where you was in your life, we all got wiped down and knocked down.
Thank you. So, I mean, I totally agree.
You're welcome.
Roseanne, was there something, any other questions that you wanted us to?
Yes, I have a question for Jeremy. And it's, Jeremy, how did the virus affect Inwood House programs in particular?
Great question. At the Inwood House lunch, it's one that I need to answer. In our shelters, so Inwood House the division operates two very important shelters for New York City. They're both located in the Bronx, and they serve young women who are trafficked, who are pregnant, and who are parenting. So this is a very vulnerable group. In both of our shelters, early on, by the end of March, the virus surged through the staff, not the children and not the parents, but the staff. And I should give a shout out to the Inwood team. They managed to hold it together because, look, the virus was also surging through our campus. We had our first infection in our detention programs on March 17th, and then it was just, I think we kept Dr. Gardner on call like 26 hours a day, right? But Inwood House, being in the Bronx, was right in the epicenter of two census tracts that got hit really badly. And these staff and the young people and the young mothers kind of held it together for about 6 weeks, still taking intakes, still staying open so that young women could walk off the street and come to us. But for 6 complete weeks, they held it together till we were able to get relief because we were all struggling, and they were struggling a little bit more because they were so far removed from all of our main centers of operation.
Thank you, Jeremy. Roseanne, anything else before I allow the panelists to say some final words?
Well, I do have one more question for Dr. Gardner.
Okay.
And it's, Dr. Gardner, how can we help our kids manage their stress levels during this time?
Yeah, this is a great question. Again, part of it is giving them a space to say that they're stressed. And the thing about children is that their stress manifests in various behaviors, right? So that when you see a behavior, the question is to ask what's the cause of that behavior. We're in a full pandemic, so it's okay for the kids to have a bad day. We're all having bad days, and we have good days and we have bad days. But kids don't always have the language and the verbal fortitude to be able to express their their stress and their hurts. And so what often happens is that it manifests in a behavior. And we don't want to be punitive or penalize behavior. We want to understand behavior. So I think once we've done that and we sort of ask them, at a level that is developmentally appropriate for each child, what is going on with them, I think then you find ways to do that. Communication is always a way. We were at home, right? So you had to find new ways to do that, right? When it became cold, when it was warmer, we all could go outside. You could do some things. I used to suggest to people, go for walks. I mean, I remember having a foster parent, or even a young mother who has like a 2-year-old, right, who's now stuck in the house. And I would say, did you used to go for walks? Well, put on a mask and go for a walk. Like, because your kids still got to get out. Even the 2-year-old is still got to get out of the house. And so you got to do that. It's okay to to have a quiet time, to meditate. I mean, there's so much literature and information about meditation and yoga in young people, right? Centering body and mind. Like it's all one. We're not segmented folk. We are one human being. And so I think those kinds of things, and then doing the thing that, that Ms. Randall said, get a pod, like a little pea pod of your family or your friends, and then, have your own little Zooms and have your own little date, you can figure out a way, don't let them lose that, right? And so these are sort of ways by which you can sort of help young people, sort of work through their stress, and acknowledge their stress.
Thank you. We are done with the question and answer.
Yeah, and it's so important. Thank you, Roseanne. And Dr. Gardner, I want to get some concluding remarks, but it just made me think as you were talking, maybe the three of you can conclude with how you're taking care of yourselves. I mean, you're doing so much work right now, and you're so, it's been so thoughtful to just have you here to talk about what's going on. But do you want to start, just Dr. Gardner, to quickly say what you're doing to take care of yourself, and then I'll pass it to Jeremy and we'll finish with Quaniqua.
Sure. I think, as Jeremy sort of said earlier, I mean, we were at this precipice of so many things, right? So you had the health issue, you had the racial issue. I mean, we currently, the George Floyd trial is today, which really was a culmination of what we saw during the whole year of the pandemic, because it's been over 300 days, and since we witnessed that as a world. And so, and then we saw all the inequities and the disparity and all the social determinants of health, housing, education, all of those things sort of rolled up into one thing, right? We literally all witnessed that together. And so just like everyone else, as someone who was, doing Zooms and being sort of this person who was an advocate and, and spoke out and also did the work that I needed to do here, you also have to find a way to decompress and to find some self-care. So I am a proponent of self-care. I talk about self-care when I do Zooms, and I practice self-care. So I actually, ironically, so I was doing exercise during the pandemic. So of course now I have a torn ligament. So now I'm going. So now I have a torn ligament.
Too much self-care.
Doing too much self-care. And but I mean, I can't wait to get back to that. It's so necessary. It's like so important. Spend time with our family. We did all the things that other people did. We found ways on social media to, get involved with music and things like that. Like Jeremy said, we did have some luxuries. So we did, we had luxuries. So we, expanded the backyard, and we did, we all started planting plants, and we did, you know what I mean? I bought a bunch of studio equipment because apparently we were going to form a studio in the basement, which never happened. But like, you know what I mean? But these are the kinds of things that we try to do. Self-care is so important. You got to find a way to do it. So crucial.
Thank you, Dr. Gardner. It's just so important to hear that. Jeremy, what about you?
I am very fortunate. I have a lot going on at work that is not just work related, meaning it doesn't feel like work, and it's been that way for the entire year. But I also work out with a group of colleagues and at least 4 days a week, try to get in 5 to 8 miles on each run, and that helps greatly.
Thank you so much. You look like it. You look great. Tanika, what are you doing to take care of yourself?
I'm booking flights all 2021. I'm out of here. My kids are out of here. I didn't like the feeling of not being, I'm serious. I didn't like the feeling of I can't do anything. My kids are used to going away. I'm all 2021. That's what I've been doing, booking flights. So God forbid, if they say y'all can't go nowhere no more right now, I'm okay. That's what I'm doing. I'm making sure me and my kid, we're outside all the time. We're going places. That's what I'm doing.
I love it. Thank you so much. And Katrina,
You're
I saw your
welcome.
little note about what do. I do stuff like this. I mean, it really does inspire me to be able to have a conversation with the three of you and to hear how you really gotten through, how your resilience, the agility of the organization, Jeremy, that you built. And so and Kanika, thank you for your honesty, for, just showing up, and I just can't say enough about hearing from the people that are most affected and how important it is if we're going to find solutions to these systemic issues that we have conversations together much more often. So I know I've taken over my time, so I'm going to hand it over to Joanna. And thank you all for a wonderful conversation.
Thank you so much, LaTanya, and thank you all for joining us today. Thank you, Dr.
You're
Gardner,
welcome. You're welcome.
and Ms. Randall for sharing so much information. I think this has been such an informative and important conversation and honest, like you said, LaTanya. So we really appreciate it, and we appreciate all the amazing work that all of you are doing. It has not been an easy time for anyone, but I think what Ms. Randall said before was so amazing, when she said, we really are all the same. And if we can focus on what Jeremy was talking about with getting more integrated and moving away from segregation, next year our luncheon will sound and look a lot more positive and better. So we appreciate this conversation, and thank you so much. And with that said, all the great work that's being done, of course, it needs to be funded. So anyone who would like to donate to the Inwood House and the Children's Village, we would of course appreciate it. The link is in the chat and it's also on the website. So really appreciate all of your support, both emotionally, physically, and then of course financially. So thank you guys again for your time. Thank you for spending your time to learn about this and for supporting this great organization.
You're welcome. Thank you.